Good morning, everybody, and I should say good morning, good afternoon, and good evening as we are here from all around the world. I am Hedy Risak. I chair the Lancet Oncology Commission on Imaging and Nuclear Medicine, and it is my great pleasure and honor to welcome you all to this webinar discussing the proposed WH Assembly Resolution on strengthening medical imaging capacity. This resolution has put forward by Cameroon with co-sponsors from Brazil, Burkina Faso, and Armenia. And it will be, as many of you know, brought up for vote during the World Health Assembly meeting in May. This webinar is sponsored by the International Society of Radiology and the World Federation of Nuclear Medicine and Biology. So the resolution builds on 2023 resolution on strengthening diagnostic capacity. And it is supported by data from WHO and the 3 Lancet Oncology Commissions on Medical Imaging and Nuclear Medicine, Commission on Sub-Saharan Africa, and Commission on Radiation Oncology and Radiotheranostics. All 3 commissions clearly demonstrated the need for global recognition of imaging as an essential component of cancer care continuum, but also its vital role in addressing both non-communicable and communicable disease, such as tuberculosis. It has become evident that technology alone or education alone will not bridge the significant global inequalities in healthcare, which result in wide disparities in survival rates. In addition to building the infrastructure and the human workforce, it is for imaging, it is essential to ensure that imaging is accessible to patients, and improved patient access will bring us one step closer to achieving more equitable healthcare. Imaging must be included in universal health coverage plans to provide further insight into strengthening imaging capacity. It's absolutely needed. And I am delighted to introduce our first speaker, Mr. Théophile Olivier Boss. Mr. Boss is the first counselor of the Permanent Mission of the Republic of Cameroon in Geneva. Mr. Boss, thank you once again very much, and please extend our deepest thank you to the Ministry of Health of Cameroon for sponsoring this resolution. At the end of all the talks, there will be a Q&A session. And for the Q&A session, please be so kind and put your questions in the Q&A section. With this in mind, Mr. Boss, would you please start?
Thank you, Chair, for giving me the floor. Good morning, good afternoon, good evening, ladies and gentlemen. It's a great honor and privilege for me to speak on behalf of the government of the Republic of Cameroon to express its pride in being a sponsor of the resolution on strengthening medical imaging capacity, while congratulating the International Society of Radiology, the World Federation for Nuclear Medicine and Biology, and the Lancet Oncology for holding this webinar, which highlights the importance and merits of medical imaging. I would like also to express my gratitude to WHO colleagues and member states for their participation in the informal consultations, thus demonstrating their consideration and interest in the resolution of strengthening medical imaging capacity. which led to its adoption during the 156th session of the WHO Executive Board on February 11, 2025. Based on the resolution of the 76th session of the World Health Assembly on diagnostic capacity building approved in 2023, the preparations for the fourth high-level meeting of the United Nations General Assembly to be held in September 2025, at which heads of state and government will meet to define a vision for the prevention and control of non-communicable diseases by 2030 and 2050 as part of a political declaration to be adopted by the United Nations General Assembly. Also, I thank the work of the Lancet Oncology Commission on Medical Imaging and Nuclear Medicine, Cancer in Sub-Saharan Africa, Radiotherapy and Theranostics, and Global Surgery. I would like to stress that personalized and proactive medical imaging will definitely have to become a more powerful and precise technological tool. And for many countries around the world, including those in Africa, this will represent a considerable qualitative leap forward. Health systems and policies put in place by decision makers across the African continent remain undeniably fragile, and most of the shortcomings identified today are technologically in origin. With the planned expansion of medical imaging in Africa, the continent of Africa is gearing up for a veritable revolution. The aim is to reduce the costs, improve the quality, precision, and interpretation of all the medical images produced, MRI, CT scans, radiology, ultrasounds, for more accurate diagnosis and more effective treatment. Finally, with the final adoption of this resolution at the 78th World Health Assembly in May 2025, a new era is opening up for the health system of a fragile continent beset by a number of health threats. All that remains now for everyone involved to get down to work with ongoing training for healthcare professionals to ensure that their skills are up to scratch so that they can better embrace the new dynamic and its array of technological tools and integrate its ethical aspects with the protection of sensitive medical data. However, Cameroon welcomes the support of Armenia, Brazil, and Burkina Faso to co-sponsor these resolutions and invite other states to join this initiative. I wish us all fruitful and enriching debates. Technical questions and answers will be addressed by the following speakers. I thank you. Over to you, Mr. Chair.
Thank you, Mr. Boss. Thank you very much. And once again, thank you. Now we can see how you were successful, that our resolution was adopted in February meeting. Thank you. Our next speaker is from Brazil. Brazil was the first country that co-sponsored this resolution together with Cameroon. And it's a great pleasure to introduce Dr. Marcelo Quires to tell us more about why WHA resolution on strengthening medical imaging capacity is needed in that part of the world, the beautiful world of Latin America. Dr. Queiroz is a director of radiology at Cancer Institute at the University São Paulo in Brazil. Marcelo.
Thank you very much, Hedy, for the kind introduction, and thank you for the invitation to join you here today. So this is just an overview of the challenges of medical image access in Brazil. I have here two graphics. One is a map of the Brazil So you can see how huge our country is. And at the same time, you can see that most of the doctors, of the physicians, are concentrated in the southeast and the south of Brazil, while in the northeast and in the north of Brazil, we have less physicians per inhabitants. And the same is true for the number of healthcare providers. Most of healthcare providers are in the southeast of Brazil and in the south. Northeast and the north together offer less access to imaging for Brazilian population. Next, please. So in a country as vast as Brazil, access to medical imaging is not just challenging, but it's a matter of health equity. Next slide, please. And then you can click again. So we saw these regional disparities in imaging access. So Brazil is a continental country with very unequal access. There's a higher concentration of hospitals and imaging facilities in the southeast, that's where São Paulo is, and very limited access with longer travel distances and fewer specialists in the north and northeast of Brazil. And when we include the rural municipalities, they rely on referrals to very distant high complexity centers, which delays the access of these patients to the imaging facilities. Just to let you know, we have in Brazil a range of CT scanners that goes even from 0 per million people in the north of Brazil to 30 plus CT scanners per million people in the southeast of Brazil, particularly in São Paulo. As this is so unequal, there are places where the waiting time for MRI scans in public hospitals can exceed 6 months. So just to show how can be delayed the patient diagnosis. Next slide, please. Again. So what's the role of imaging in the public health care? So imaging is essential for a lot of clinical indications. It's essential for early cancer detection, for cardiovascular and neurological diseases diagnosis, but also for treatment, monitoring, surgical planning. And all these indications, imaging has a direct impact on patient survival and quality of life. Just to let you know, patients who require radiotherapy, 70% depends on imaging to plan his therapy. And when you have limited access to imaging, this leads to late-stage diagnosis and worse clinical outcomes. Next, please. So bringing to imaging next. For cancer care, we have at least 4 indications for imaging, for early detection, for diagnosis and staging, to guide treatment through imaging and also monitoring response. Some interesting data is like when imaging is used and for breast cancer, the survival rate goes from 90% when detected early to 27% in late stages. When using PET-CT to diagnosis and staging tumors, the management can change in up to 50% of cases. Having treatment guided by imaging reduces hospital stays by 30 to 50%, which could lower costs and improve patient outcomes. And when you use CT to detect the efficiency of the treatment, when the tumor shrinkage is above 30%, it has a strong and positive correlation with improved progression-free survival. Next slide, please. Again, and so just bringing to our reality here at the Cancer Institute, we have this first column here named ESASP. Although we have a very high volume imaging center, like we have 200,000 imaging procedures per year, serving patients efficiently, but more than 50% of our patients arrive in our institution with stages 3 and 4 cancer, which is advanced disease. Just to compare with another hospitals in the state of São Paulo, where they have together primary care, differently from our center, which is a tertiary reference cancer center, they have much less advanced diseases. So the difficult to have access to imaging delays the diagnosis, and so the patient comes in a very advanced stage with worse outcomes. Next slide, please. There are the main barriers to universal access. This is just to summarize what happens in Brazil. We have this unequal distribution, and most imaging equipment are concentrated in major urban centers. We still have some limitations in infrastructure, lack of investment and equipment maintenance, which is really expensive for us. We also face some shortages in workforce with few radiologists available, especially in remote areas. And we still have long waiting times in the public system, as I told you, that goes up to 6 months to perform an MRI. And what we can see as solutions, so we need to expand and decentralize imaging services to facilitate access to everybody. We should promote the public-private partnership and increase imaging availability in the public system. We can also integrate the technology advancement and using AI and telemedicine to optimize workflows, reducing the waiting times. And this kind of initiative with these WHA programs, such as this strengthening medical image capacity, also help us to overcome these barriers. Next slide, please. So in conclusion, we need to try to make imaging for all as a global health priority. This is expanding medical image is not just about technology, it's about saving lives. So in Brazil, we face significant challenges in ensuring universal access to imaging, especially the lack of equipment and specialists that directly impacts early diagnosis and treatment. We have some solutions such as AI, telemedicine, and investment in infrastructure, which are crucial to expand this access to medical imaging and then have some lives saved and reduce the long-term healthcare costs. So next slide, and thank you very much for your attention. This picture of São Paulo with our University of São Paulo just in the middle. Thank you.
Thank you, Marcela, very much. It's so well said. Imaging saves lives. It's not a tool, it's not an expensive toy, it saves lives. Thank you so very much. I'm sure there will be questions for you. Our next speaker is Dr. Adriana Velasquez Berumen. I think you all know Adriana, and we are so very deeply grateful to her. She's a team leader for medical devices, but she has been a tremendous advocate, a leader for imaging and diagnostics. Adriana, for everything, thank you. And we are really looking forward to your presentation on the overview of WHO's current work on strengthening medical imaging capacity. Adriana.
Thank you very much, Hedy. Thank you very much to the organizers of this webinar, ISR and WFNMB, to invite me to this webinar. It's been really a pleasure to work with you all these months. And well, let me get into my topic. So talking about medical imaging in WHO. So first of all, I want to tell you that medical imaging is a big component of health systems. So, and I just put the cover of the book that we have on cancer book that actually has a whole chapter on medical imaging and nuclear medicines. That's the image on the left. And the image on the right is our website that talks about strengthening medical imaging. And that has the publications and books that have been done. But really, there's a huge need in this area and has been lagging behind. So this is a great opportunity to make it, again, go higher in the priorities because we know these technologies needed exactly following what Hedy and the previous speaker, Dr. Queiroz, was stating on the importance of having medical imaging. So may I have the next slide, please? Okay. We were very delighted that with Monsieur Théophile Bosse from Cameroon, as he was proposing, and his country, Cameroon, was proposing the resolution. We had a lot of member states information sessions, as he mentioned. They were not easy, they were complex, but then the draft document was finally discussed in the executive board in January this year. And we were very, very happy to know that it received no conflicts, no problems, but only confirmation from various member states on the importance. So we absolutely are thankful to Armenia, Burkina Faso, Brazil, but then we also had other countries that came forward, like China and Thailand. So there were many countries that said the importance of medical imaging and that they really were looking forward to having this resolution passed. What is really important, and this is a picture from the executive board that happened in the executive in WHO in February. What is really important is recognizing the importance of medical imaging, not only for some infectious diseases, like tuberculosis was mentioned before, but for so many NCDs, and exactly what Dr. Keiros was just mentioning. So we recognize that it's vital for the diagnostic for many numerous communicable diseases, non-communicable diseases, but also traumatic injuries and all other health conditions, for example, gynecological conditions. It is a huge need to have cost-effective medical technology, but also everything that represents them. It is not just the technology, but everything that goes around it. So we need the infrastructure, we need the healthcare workforce, the training, but also consumables. And we need to be sure that those technologies will be very well maintained, that will be affordable, and that the information from the patient will be well processed, and the reporting and the interpretation. So it is a whole system. It is not only one technology. In my case, I am responsible for the technological part of as a medical device in WHO, but it is very important that it's a whole system that needs to be together. So I just don't know if you're familiar, but every WHO resolution has two sections. A background information, that is the paragraphs that you can see here, but also two sections, the section that is for member states and the section that is for WHO. In the section for member states, we have, for example, to promote appropriate and continuous access to quality, safe, affordable, and cost-effective medical imaging, implementing appropriate policies, strategies, programs, norms, and standards. So there is also a component for countries. On the other hand, to consider WHO documentations and guidelines to be used in countries. So, for example, to improve their national list, including the medical imaging technologies that are selected by WHO, but also to consider easy to use and training and the approval of national regulatory bodies, which is very important, and consider all the health technology management. In the part of WHO, we have a lot of work to do too. So it is to promote the access to quality, safe, affordable, and cost-effective medical imaging, to provide also guidance to countries so that they can have the policies and strategies that they need, but also to develop training. And many of these things, WHO cannot do it alone. So there is also a statement in the resolution that says to coordinate and to look for international collaboration and look for cooperation among all stakeholders. So this is really important, and to join global diagnostic initiatives. Next slide, please. Okay, what WHO has been developing, and this was a request by member states, is that we have to have a database of all the medical devices. And as you know, medical imaging equipment is a type of medical device. It is of high cost, it requires high infrastructure, but it is indispensable. So it is already being listed in the priority medical devices books. And by a mandate by the World Health Assembly, we had to develop MEDEVIS. MEDEVIS is a medical device information system. As you can see here is MEDEVIS, and that includes all the priority devices. And if you search there, you can have angiography, ultrasound, etc. And then you have all technical specifications that are like in the image shown to the right side. And the link to those publications are also in that website. Next slide, please. What is really important is to consider the whole value base for medical technologies. So in WHO, we're looking into having a right nomenclature, and I'm very glad to share with you that Brazil is one of those countries that have really progressed and is moving to the GMDN. That's one of the nomenclatures so that we can all use the same naming. Then we have everything regarding innovation, manufacturing. Then WHO is working with national regulatory agencies to see how can we advance the approval and market approval in regulatory agencies. Then we have what is the selection of national lists for medical devices for reimbursement and procurement. And that is where the priority medical devices that are listed in MEDEVIS can be taken by countries to put them in their list. And that, of course, includes many of the medical imagings. But then we have the health technology, that was the health technology assessment part, and the health technology management part will be linking about everything regarding procurement, installation, inventory, training, maintenance, safe and appropriate use until the commissioning. And this is important for member states. It is not easy to do procurement of many of these medical technologies, medical imaging technologies, although there are many others that are very simple and are really game-changing, like portable ultrasounds or point-of-care technologies. Next slide, please. Then what I was telling you is the priority medical devices are selected by WHO, and then they can be used as a reference list to member states so that they can update their national diagnostic list. The resolution calls for this work being done by WHO. We in consultation with experts like the ones that are here today. And then we draft this list so that countries can have their own committee and the selection process to decide, depending on their local needs, their epidemiology, their resources, and then decide where to place those technologies, primary care, secondary, tertiary care. But there are imaging technologies for all of these levels. And that is a message we want to convey. We want to use medical technologies even from primary care. Next slide, please. And then as everything is now becoming really digital and interoperability, so what we're doing now is we are having the database for MEDEVIS, that's like a clearinghouse that has all this information that will be linked to the International Classification of Diseases, and will also be linked with the Universal Health Coverage Compendium so that when interventions are decided, then if we have to say breast cancer, then we know we need a mammograph, then the information of the mammograph will be interlinked. So all these interlink, we're working on that with all our WHO colleagues. Next slide, please. Then finally, what we have is we have to do a lot of advocacy, and we have to place all this information in the WHO website. So we have the information about the diagnostics when the diagnostics resolution was approved 2 years ago. Then we have one specific activity that's called strengthening diagnostics capacity, and then the one for strengthening medical imaging. And we want to put there all the information that we have on WHO guidelines, norms, and standards, and related links. And then we have developed, since the diagnostics resolution came in, what is the WHO Diagnostic Task Force. So we're bringing together the people from WHO internally to align not only to work on in vitro diagnostics, that was a huge percentage, but to work in all diagnostics, because we need the blood pressure measurement as well as we need ultrasound, and then we need the in vitro lab test. So everything is integrated. And for that, we're working and we're happy that we had a meeting just yesterday on the Global Diagnostics Coalition to link all the diagnostics together. Then the last slide, please. What is really, really important, and I'm really glad our colleague from Brazil just mentioned it, because I do mention it in every of my conference, and I always have a white pen around, is this that it is not the technology that matters, but really the patient that matters. So we all are here, and we're very glad to be with many of you here so that we can all focus on the patients and the best patients' outcomes and to help the diagnosed so they can have prompt and appropriate treatment. And that is the work that we do in WHO, and that is the work that we look forward to do with all of you. So thank you very much.
Thank you, Adriana. You so well said. You do so much, and we are really very grateful for the coalition that you are putting together. As you said, it's all about patients, and this is why we really, really care for patient access. So when we have the resolution, then imaging will be included in our national health policies. So thank you very, very much. Our next speaker is from IAEA. So we are really lucky to have a support from both WHO and IAEA. Dr. May Abdel-Wahab is a director of the Division of Human Health at International Atomic Energy Agency, known to so many of us for her many achievements and accomplishments, one of which is, of course, Rays of Hope. We are looking forward, May, to your presentation on overview of IAEA support for medical imaging, in particular in the context of the Rays of Hope initiative. May?
Thank you very much, Hedy, and thank you for the invitation to speak today. As we heard before from our colleagues, there's a huge role for medical imaging that we recognize. And in addition to what was said about, for example, guiding treatment in surgery, it's also guiding treatment in radiotherapy and many others. And now we have personalized medicine and other opportunities. But when you look to the right, you'll see that we have a major issue in terms of how to reach patients. There is inequity that's quite significant, as you can see by the blue person, 225,000 served by one CT versus over 1.5 million served by one CT. So we see that, but that's not the only issue that we have to keep in mind. The radiologists, for example, and where they're distributed is also another factor that's quite significant. And there's an inequity in that as well. Next, please. So we have several global initiatives. Some of them are coordinated by WHO and participation in these initiatives by various groups. And breast cancer, cervix cancer, global childhood cancer, all of them attempting to increase treatment, diagnosis, and hopefully improve survival down the road. The Rays of Hope initiative is coordinated and implemented by the IAEA, and the purpose of it is to actually set up new centers and create things on the ground, an implementation mainly. Next, please. So this is not done in a vacuum at the IAEA. There's many different activities that lead into that and support Rays of Hope. So the first issue is we have to understand what the needs are. And we have these databases that support and show what machines are there and so forth. And this is an example from Imagine that supported the Lancet Oncology Commission that Hedy was referring to as an example, but also we have missions on the ground to find this data. In terms of research opportunities, because innovation is always important, and you can see that we have quite a large number of research activities, whether clinical trials, basic research in dosimetry and quality assurance, and many others. Of course, global health and health economics and so forth. On the right-hand side, you'll see that education and training is extremely important. We heard that it's not enough to have the machines, we have to train people. So many activities in education and training, full curricula. So anybody who wants to start a new program can use these curricula, and also how to set up centers. And all of this information is available for free on our website. We also have support in terms of education, tumor boards and other things. Next, please. So whatever we do, we cannot forget about quality. That's number one. You know, an example is what we saw in the early days of mammography, where things were missed because of there was issues with quality. But in addition to guidance documents, there are also missions to look at quality, like Quadrille, for example, and others. A methodology that's been developed at the IAA and has been used by many countries around the world to develop their quality assurance methodology. Radiation safety cannot be understated, but access, setting up centers, training people, doing something on the ground. Next, please. So this is an example of some of the projects that we have, and you can see here that we have a large number of active projects that are happening in 124 countries, and this is just in this cycle 24-25. We have fellowships, which I'll describe later, in terms of long-term training, also short-term training, so we can mint a radiologist or a nuclear medicine physician, but we could also help them improve their skills. So there are different types. We send people there, scientific visits. We have expert missions to look at specific areas that they need support in, and so forth. And of course, procure equipment. Next, please. But that's not enough, because as we know, once someone is minted, then they have to continually learn. And so we have to prepare e-learning and materials and different types, including full curricula, webinars, interactive modules, and multimedia. Next, please. And then countries come to us to ask us, okay, so where shall we put a certain center, for example? And this is quite a complex decision-making based on the context, on the population, on many other factors. And so this is an example to maximize our ability to reach a larger population. We look at this, we use geographic information systems and other things. Next, please. And then in terms of innovation, these are some examples, like optimization of pediatric imaging, which means that we can give less doses of radiation to these children without sacrificing quality. Also being able to do quality assurance, automated quality assurance, and do research to develop the methodology and so forth. Next, please. So there's also a dosimetry lab that does a lot of quality assurance on the devices themselves. An example, mammography dosimetry and that. So this is really the center of many other dosimetry labs around the world. The center of a whole network of secondary standard dosimetry labs. Next, please. And now to Rays of Hope. So what is Rays of Hope? Basically, it was launched in 2022, and we were hoping to improve specifically cancer outcomes. How? By increasing access to radiology and nuclear medicine and so forth, and with a multi-pronged approach. Next, please. There are three main pillars. One is we want to support access through supporting capacity building and equipment, meaning that we set up centers and train the people who are going to work in those centers. The second pillar is to ensure sustainability. So after we do this, we set up centers, which we've been doing for 60 years. We want to make sure that these centers are still there and will continue to function. And the way we're doing it is by south-to-south collaboration, where we have what we call anchor centers, centers of excellence, that will go ahead then and support everybody else. And then the third is innovation through research and development. And for that, we have a Sunrise initiative that basically is a global database that we can look at the outcomes and be able to see whether or not we're successful or not. As you can see in the map, over 90 countries have requested support from the IAA, almost 93, 94 now. Next, please. So these are some examples of things that have happened. Expert missions, these are all anchor centers where we have specific missions and discuss the work plan that's going to happen and how we can help them so they can help others. But also, it's very important to say that on the ground, we have a lot of recipient countries, which means countries that are getting new machines that we're buying. We're training people long-term, new radiologists, new nuclear medicine physicians, RTTs, technologists, radiopharmacists, many different specialties. And we're training them for the centers that we're building. Next, please. But as you can see, it takes a village, and you can see a large number of organizations that collaborate with us. We have 120 physician volunteers and medical physicists that are working with us in the Rays of Hope initiative as well. And of course, WHO is one of our big collaborators, and we've worked a lot with Adriana in terms of some of the publications that have been shown and the guidance documents, because of course the IAEA is the global focal point for radiation and nuclear, and with that we have extensive opportunities to support some of these activities. Then other groups, as you can see, wide, but not only UN groups, but also society partnerships and also industry. Next, please. So in short, this is overall what we've been doing right now, including regional training and so forth. But we are aware of many of the challenges, and this is what we hear a lot. And that is why the costs, the technological complexity, the access, all of these things are things that are brought up and have been addressed through the Lancet Oncology Commission to show, next please, how important it is to implement. So it's not only a humanitarian mission that we have, because everybody deserves access to care, but it's also economically feasible if you look at the investment versus the net benefit. Next, please. So thank you very much, and we're really excited about this. As you can see at the bottom here, you can see the timeline of what was going on in terms of the resolution, and we really thank you all around the table for the extensive effort in getting this to see the light so far. Thank you.
Thank you, May. Thank you very much. Just like you said, it does take a village, and I think this webinar really shows the breadth and diversity of all of our activities in making this happen. So thank you so much. Our next speaker is Dr. Bib Allen. Dr. Allen is the president of International Society of Radiology, deeply committed to improving global health. And yes, he does stand up for imaging, but imaging is so important at every step of communicable and non-communicable diseases. And Bib, it's such a pleasure to introduce you, and we are looking forward to your topic, strengthening medical imaging. The time is now. Thank you, Bib.
Well, thank you very much, and please let me add my thanks to all of you for joining us today for this important discussion around strengthening imaging capacity worldwide. Each year, 18 million people die prematurely from non-communicable diseases like cancer and stroke and heart disease. And a staggering 86% of these deaths are occurring in the low and middle income countries, accounting actually for 70% of the deaths in the populations under 70. Thankfully, many of these diseases are preventable or treatable, but only if they're detected early. Yet 67% of the population doesn't have access to life-saving medical imaging. So this is truly a global health crisis, and thank you for being here today. Next slide. As president of the ISR, I want to emphasize that our organization is committed to taking on this challenge in every way we can possibly do. Our missions are to advance, health equity through improved imaging care, to promote radiological quality and safety and expand education and training in underserved areas. We are longtime partners and collaborators with the WHO and the IAEA, and certainly appreciate them being involved in our webinar today. Next slide, please. I think it's fair to say that non-communicable disease worldwide is not just an emergent problem. One author characterized it as being truly an epidemic. And unfortunately, when you look at the heat map, you can see the wide disparities in outcomes from these non-communicable diseases in low and middle income countries versus higher income countries. The WHO has a bold goal to reduce non-communicable disease mortality by 33% by 2030. But early detection is going to be key, because without imaging, these goals will be impossible to achieve. Next slide, please. As you've heard, imaging is critical for screening, detection, and treatment. I feel like where we are now in some of the low and middle income countries is emphasis on radiography and to some degree ultrasound. But if we're really going to tackle cardiovascular disease, stroke, cancer, prenatal care, and trauma, we really have to ramp up the access to imaging. And although people will say that the causes are multifactorial, I think the lack of imaging access really plays a major role in the disparities of outcomes that we see. So next slide, please. Just to emphasize once again the critical shortage of medical imaging, these heat maps from the IAEA show the overall lack of mammography and CT scanners. And so you look and say, well, no surprise that we're seeing late-stage disease and breast cancer and poorer outcomes from stroke that are being in other countries. Next slide, please. But we have to be able to overcome some of the barriers. And we'll talk about the geopolitical barriers and infrastructure challenges, the needs for stable power, roads, internet connectivity, the financial barriers. It's true, imaging equipment is not inexpensive, but it can be affordable if tailored to the region. And then how are we going to manage the significant lack of trained workforce? So radiologists, radiographers, and medical physicists. How can we exploit and enhance the use of artificial intelligence? So next slide. And so this is where we believe that the resolution comes in. The WHO is well positioned to be a catalyst for efforts to strengthen medical imaging capacity in low and income countries. This resolution will align with pre-existing WHO initiatives for universal health coverage and the delivery of primary health care. And it will help develop strategies between member state governments and the NGOs to have a global solution to the problem. So next slide, please. And once again, I want to emphasize that the international medical imaging community stands ready to continue to our support for increasing imaging capacity. But it's really not just the imaging societies. Next slide, please. When we put together our constituency statement of the NSAs, we had 18 organizations that signed on with us to support the adoption of this resolution at the WHO Executive Board. And these are organizations who recognize the importance and power of medical imaging in order for their members to be able to treat the patients with non-communicable diseases. So next slide. So the medical organizations stand ready to partner with the WHO, the IAE, and the local governments to figure out ways that we can prepare the workforce, including medical physicists, radiographers, but really to educate the existing workforce so they'll have the tools that they need. We're going to need some novel solutions, but we stand ready to work with the communities to make that happen. Next slide. One example is our work with the IAE. We have practical arrangements with the IAEA, and this is a targeted education course in the Caribbean where we went with mammographers and other breast imaging specialists to help train the trainers so they could go back to their hospitals and their communities and step up the care that they're providing. And so we also partner with the IAEA regards radiation safety. The ISR organizes all of the global radiation protection societies. And it's going to be very important to make sure that the community is aware of what they need for radiation safety to protect patients and healthcare workers. And so the ISR and other imaging societies stand ready to participate there as well. So next slide. The importance of cost-effective imaging equipment can't be the need for cost-effective imaging equipment can't be overemphasized. I think that there are a lot of us who think, well, we can just donate equipment when it's removed from a hospital in the US or in Europe or somewhere else and bring it to an underserved area. But so many times this equipment ends up in a junkyard like this because it doesn't work, it's not serviceable, there are no service contracts, and there's never any proper training for its use. So we have to think about beyond donations and sustainable solutions and look and work with manufacturers to look for cost-effective equipment. And the good news is that it's out there. These picture MR scanners for brain MRI, a portable CT scanner. All of these can be adapted for use in small clinics with normal power consumption and maintenance. So next slide. And finally, the promise of artificial intelligence has tremendous potential. But I think that we have to recognize that in order for it to work, it has to be tailored for use in the lower and middle income countries. And that's why the ISR supports initiatives like Africa AI, where we're training supporting the training of local data scientists who can then deploy tailored AI solutions. So next slide. So our call to action is this small hospital with a workforce that's ready to help their patients in their community. Let's give them the tools they need to make imaging accessible, affordable, safe, and effective. Next slide. We believe a big step forward will be this World Health Assembly resolution on medical imaging. It'll mobilize global support, drive policy change, and ensure coordinated efforts amongst governments as well as the NGOs. And we do it because where you live should not determine whether you have access to life-saving medical imaging. It's not just about the technology, as we've said, it's about equity and saving lives. We stand ready to partner with the UN agencies, with the local governments, and because now is the time to make this happen. Thank you very much.
Thank you, Bib. It's absolutely amazing how much you are and your society are doing to improve global health. And just like you said, whatever we do with imaging has to be sustainable. Which also brings, it has to be horizontally integrated from energy to equipment to patient access, sustainable. So thank you so much. Our next speaker is Dr. Andrew Scott. Dr. Scott is representing here one of our sponsors for this webinar, and that is World Federation of Nuclear Medicine and Biology. But Andrew also was absolutely instrumental for the Lancet Oncology Commission on Medical Imaging and Nuclear Medicine. And I would say, May, if you don't mind, equally instrumental for the Lancet Oncology on Radiation Therapy and Radiotheranostics. Andrew, we love working with you and really looking forward to your thoughts on strengthening medical imaging. The time is now. Andrew?
Thank you so much, Hedy. It's very clear that there's a huge momentum in trying to ensure that we have equitable access to healthcare. But we also need to be able to convince governments. We need to be able to show that the evidence is clear that if you improve access to imaging, you will achieve improved healthcare outcomes. You can get return on investment. And our Lancet commissions are really focused on, what is the current state of imaging through both the equipment, the workforce, its current use, but also what are the justifications for its use that really can provide the huge impetus to enable equitable and improved access to occur. We've already heard mention about the importance of imaging, not just in communicable, but non-communicable diseases. We know that it results in a huge number of deaths every year. 17 million people die from non-communicable diseases before the age of 70, and 86% of these are in low middle income countries. This applies both for cardiovascular disease, but also cancer, respiratory disease, diabetes, and particularly stroke, where the management of stroke in a way which can dramatically change the outcome for patients is dependent on accurate initial imaging very early after the onset of symptoms. In this context, from a clinical perspective, medical imaging is essential to both diagnose and also to treat non-communicable diseases. And it can also apply to trauma and for surgery and for targeted therapies such as interventional radiology, as well as for theranostics, which is an emerging area of important treatment for patients with cancer. Next slide, please. So as Hedy has mentioned, there have been some very impactful Lancet oncology commissions that have provided the key data which enables us to justify this resolution and to show how access to medical imaging can have such an impact on patients worldwide. Our Lancet Oncology Commission on Medical Imaging and Nuclear Medicine focused particularly on the current landscape for imaging, both from an equipment, infrastructure, workforce perspective, and also how improving access to imaging could really impact on the health outcomes of patients, and also the economic justification. And just for cancer was the principal focus of this large commission. Next slide. As has been touched on by May and by Bib, imaging equipment equity of availability is remarkably different around the world. Here you can see in this plot for CT, MRI, SPECT and PET, the vast differences which occur in the mean number of scanners per million population in high, upper middle, which is in orange, low middle, which is in grey, and low income, which is in yellow countries. It's very difficult to expect equitable health outcomes when imaging, which plays such an incredibly important role in diagnosis and patient management, shows such marked differences. And even though we also saw about mammography and CT, which are some of the more basic imaging techniques. We also know that the other more advanced imaging modalities, such as MRI, SPECT, and PET, can have significant impact on patient care as well. Next slide. This is just a world map representation for CT. You can clearly see that in Western Europe, North America, some Asian countries, the number of CT scanners is quite consistent, but throughout Africa and also through Asia, so more than 75% of the world's population, access to CT scanners really is at a level which does not allow adequate and timely information being provided for diagnosis and treatment. Next slide, please. For MRI scanners, you can see that it's possibly even worse. And we know that MRI is incredibly important for imaging for brain disease and also in pediatrics and many other conditions in regions of the body. Next slide, please. And positron emission tomography, or PET, which is really increasing in its use, particularly in cancer, but also in neurologic disease and emerging in cardiovascular and inflammatory conditions. The number of scanners per million population is quite remarkably different. And in many countries, as you can see in grey, there are no PET cameras at all at the time that this survey was done a couple of years ago. Next slide, please. We undertook a very complex and detailed analysis of how cancer deaths could actually be impacted by access to imaging and also access to appropriate treatment and quality of care. It's estimated that over a 10-year period for the 11 most common cancers, 76 million people would die around the world from cancer. But if you are able to improve treatment access and quality of care, you would save 5.4 million lives. But if you actually added improved access to imaging, so earlier diagnosis, more appropriate selection of treatment, that would be almost double to a saving of 9.6 million lives purely by improving imaging availability. Next slide, please. We then looked at the economic costs and benefits over that 10-year timeframe, and we're able to demonstrate that if you were investing $1 in improving access to treatment and quality of care just for cancer, you would get a return on investment of over $6 per dollar that is spent. But if you then added imaging, next slide, please, you would almost double the return on investment to over $12 for every single dollar invested by adding improved access to imaging with scale up of treatment and quality of care. Next slide, please. When just looking at imaging, you can see that the estimated return on investment by a dollar that's invested in improving access to imaging, you can get between $50 and over $100 return. And this is consistent across all continents and really illustrates the importance and financial justification for improving imaging access. Next slide, please. And next one as well. Thank you. One key thing is the importance of digital connectivity and technology. This was touched on in prior talks as well. We know that by improving digital connectivity, you can improve the timeliness of being able to obtain information on the images that are being obtained. If you have electronic medical records, the compilation of data for an individual patient clearly impacts on patient care. And there are initiatives at the moment to be able to implement electronic medical records at a both regional and country level. But that perfectly aligns with then being able to access the digital data from imaging, so that at point of care, you can have ultrasound devices or X-ray units. At small centres, you may have CT scanners. And at regional centres, you can have the higher level technologies such as SPECT, MRI and PET. And of course, analytic techniques and AI will allow us to be able to get rapid initial assessments of the results of the imaging, which will improve the quality of care. Next slide. As has been mentioned, it's not just for initial diagnosis and imaging that this resolution will play a key role, but for treatment, whether it's for surgery, whether it's for radiotherapy or new modalities such as theranostics, imaging is a critical part of enabling appropriate decision-making, planning, and implementation of these new treatments for our patients. Next slide, please. So in summary, we know that there are unmet needs for medical imaging equipment. There are solutions for funding, for lower costs and more mobile technologies. By implementing these, by improving the workforce that is well trained, we will be able to improve the outcomes for patients with a range of both communicable and non-communicable diseases. And so we also can see that this investment is associated with a high economic return, and this will provide the momentum for government support. And we hope for the passing of this resolution in May at the World Health Assembly. Thank you.
Thank you. Thank you, Andrew. As always, outstanding, clear, and data-driven. Absolutely fantastic. Thank you so very much. Our next speaker is Dr. Will NGOs. Will is really a very unique physician, radiation oncologist by training, born in Cameroon. And his work on the Lancet Oncology Commission on Sub-Saharan Africa, I think it's a single publication responsible for more than many others we read for bringing attention to the needs of Sub-Saharan Africa. And with his work in the Global Health Catalyst, I hope you will tell us a little bit about educational efforts and your universal global university. We are very much looking forward to your talk on transformative impact of imaging on cancer care in Sub-Saharan Africa. Will.
Right. No, thank you so much, Hedy, and for your leadership in being able to get us really moving this resolution. So I'm going to talk a little bit about cancer in Sub-Saharan Africa and really the transformative impact that imaging can have on the whole continent. And I want to start with this quote that came out from this Lancet Oncology Commission that I was honored to chair with a lot of participants across the continent. It says, we have seen too many reports, too many words, too many good intentions, too many families torn apart, and too many excruciatingly painful deaths to see yet more delays in taking collective action to accelerate cancer control in Sub-Saharan Africa. And ladies and gentlemen, I really want to say that this resolution is one of the clear actions that we are so excited to see happening. And to that point, as Hedy mentioned, I was born in Cameroon, but really appreciating the Cameroonian government with Mr. Boss, and also Professor Kengom, Blaise Kengom, who has really helped to champion this resolution forward from the continent. And obviously all the other country ministries who have really seen this as a reason why they should do this. So I'm going to share a little bit of background on why this is so important for Africa and why it would have a very transformative impact. Next slide, please. So through this commission, I just share a couple of insights that came out of this commission, right? So this commission was really created to look at what the scope of cancer is in Sub-Saharan Africa. And we've already heard from a number of speakers, including Andrew, talking about the impact of this and also May about on cancer. So what we found out was cancer is really the challenge that's faced now by the Sub-Saharan African continent on cancer is enormous. When we did this, we actually showed how, the number of deaths that are coming out of this, the impact is bigger than what happened for COVID-19, right? And so if we mobilize the whole world against COVID, I think this is even more urgent. If you just want to think about all lives matter, we need to mobilize the same kind of action. And so we actually revised this up, to about 1 million deaths per year by 2030. Obviously, we know globally there are about 10 million deaths per year from cancer alone. And I would say for Africa, this was an underestimate. We knew because there are not many cancer registries across Africa. So these were underestimated. So more people are likely dying of this than we see. Next slide, please. Yeah, and sorry for sharing this really graphic image, but I hope it shocks you to see why imaging is so important here, early detection. So we saw that the leading cancers in Africa are breast cancer, cervical cancer, prostate cancer. But what's really shocking here is the high mortality rate, because of late diagnosis, and what the impact could really be if you had early detection and imaging and all of the things, and even image-guided treatment and monitoring, like we know the impact of imaging would have. And just to share you some of the data, in Cameroon itself, 65% mortality to incidence rate. And this is underestimated. We know that that's higher than that. We also know that, about 70% of the cancers in sub-Saharan Africa are detected late. I would say 90% more likely. As you can see, what we found was that it can range from 38%, 30% in South Africa to up to 98% in Nigeria, just thinking about late presentation. And so, the impact of imaging, being able to have early detection and diagnostics and access to that would be really tremendous. Next slide, please. Yeah, so coming out of this commission, we had 8 calls to action. One of the big call to actions here was increasing care, access, and increasing cure. And the importance here is really thinking about early screening, detection programs, and all of this would not be possible without imaging. And obviously, you need the allied health professionals. You need the workforce to be developed. And so we did actually have one of the calls to action was really focused only on workforce development. And like Hedy mentioned, we actually coming out of this, one of the impacts of the actions that we've had is really the establishment of this global oncology university. That's currently trained thousands of people already across the continent, including in image-guided radiotherapy. Right now, we are doing that for even hypofractionated radiotherapy that can really increase access to care. And so again, in all of this, imaging is really critical. Next slide, please. So I'll just kind of, make it really quick and mention that, some of this data has been really enforced by the wonderful commissions that Hedy and Andrew and May have led. They kind of talked about how imaging, the return on investment, if you have that, for cancer alone, if you invest $1 per capita in sub-Saharan Africa, this is going to double the survival rates for many of the cancers. And so it's really, really important for us that we do this investment, that this World Health Organization resolution is moving forward. For breast cancer alone, just giving the example of that, like I mentioned, you have stage 3 and stage 4 is the most commonly detected when women present. And so if you just provided increased access to imaging, so you do that early, stage 1 and 2, you would increase survival substantially. You would double the survival rates. So this is really important to see, especially for breast cancer, which is the leading cancer in sub-Saharan Africa. And then for cervical cancer, investments will return, imaging-based screening could avert 4 to 6 disability light years, just by investing $100 in this. $1 in imaging, I think Andrew showed that some of his data, $5 to $10 return in healthcare savings and productivity. And then if you just invest 100 million, we can see how the return would be in the order of up to $1 billion. And so the impact would really be transformative, not only in saving lives, but also economically, in the return on investment for the countries. Next slide, please. Yeah, so I just want to make this sweet by saying that, to do this, why are we having this webinar today? Because we really want to mobilize action around this. And I would say that everybody's help is needed, to be able to create awareness around this and really move this resolution forward. So when we launched the Lancet Oncology Commission for Sub-Saharan Africa, we went across different African country ministries of health and capitals and said, this is really, really important. And, these pictures here kind of show even going to the remote areas. You talk about disparities and equity. So in the top left, you see the image going to the Kumasi. We've actually had the Ashanti King now is really investing in, establishing a comprehensive cancer center of excellence there, which is going to include CT imaging, MRI, and all of those things. And that's a really good example to show why, mobilizing action will really have a big impact here. And then you had the First Lady of Ghana, obviously really thanking the Lancet. We really have to acknowledge the visibility that the Lancet has created around this, mobilizing action around this with David Collingridge. And then, the image to the bottom left is really showing, we are actually with Hedy, we've engaged with the White House around really investing in imaging and actually around cancer. And so there is currently a parallel effort going on around Global Cancer Fund. And I know that the last meeting we had, the World Bank has decided to take on this, to actually really work on this towards announcing something during the UN General Assembly in September. So this is the passing this resolution will just really supercharge this effort. So, this is more motivation why we need to pass this resolution, because it can really mobilize additional action around this. And this last picture, I just want to mention that even though I talked about Africa, this was a recent image in December when we met with the president of Bangladesh, the Nobel laureate Yunus, who is really mobilizing the SAARC region, the Southeast Asian country region around this. And what we are saying here is that, the world is ready. The world is ready to pass this resolution, and we really can all come together to make this happen. And obviously, just want to end by appreciating, all the people who have been championing this. We know this is really going to make a big impact, not just for Africa, but for the whole world. Thank you so much.
Thank you. Thank you, Will. Simply fantastic. You are such a wonderful spokesperson for this resolution, and we really appreciate. And congratulations on everything that you do around the world, truly. Before I turn the podium or the moderation to the QA session, I would just want to say to John and Giovanni, I would like for all of us to say a big thank you to the organizers of this webinar. And those are really the pillars of our strength. And Miss Martina Skursik and Monica here. I'm sorry if I butchered your last names. We always call each other by first name, so hopefully I'm forgiven. But Martina and Monica, sincere thank you on behalf of all the speakers. The work was tremendous, and I hope you like the outcome. And now to the QA session. At some point, we had 88 participants, which shows a tremendous interest, really, about how to improve imaging. Imaging saves lives. Imaging is critical, as each and every of our speakers said so. So to John and Giovanni, thank you very much for moderating this. For all the participants, please be so kind, and just a reminder, once again, put your questions in the Q&A section. So all thank you, and John and Giovanni, the podium is yours.
Thank you very much, Heidi, and thank you very much to all the speakers and all the attendees. To make sure that we have enough time to answer at least the questions that are on the chat, I would start first by asking a question about the limited access to medical imaging, and especially to the more advanced techniques such as CT and MR. And this question would probably be at best answered by Bib. Bib, if you could answer about area with limited access to medical imaging, would you recommend initiating efforts on access to basic modalities, for instance, X-ray, ultrasound, or does the heavy equipment also be implemented and at which pace?
Yeah, well, I thank you, John, and thank you for the question. I think that I think that there are two things in play, to be honest. We know that, for instance, in stroke care and probably in some cardiovascular care, that immediate access to imaging is going to be important. So we need to figure out ways to get equipment to the point of care, sort of in concert with the WHO's primary care initiative. So this is available really at the point of care without the need to travel. This will require specially tailored equipment, but I think all of that will create a sustainable situation for the communities. As I said in my talk, the single sort of machines that are dedicated for head or dedicated for breast are easily located in the clinics. So I think, yes, I think we need to have some of the CT, MR available at the point of care.
Thank you very much, Deep. Another question that would be addressed to May would be about Bangladesh. They have 23 government nuclear medicine center there, and they're asking about how to enroll in the Rays of Hope initiative. I guess maybe, May, you can give some hints about who to contact or how to do this step.
So thank you for that. So I think that the first thing to remember is that Rays of Hope is part of initiated by the contact with the government. So in Bangladesh, you'll have a national liaison officer that will be able to reach out to and inquire about that. There may already have been a letter that was sent through the government specifically requesting, being part of Rays of Hope. Of course, just to remember that we have several waves. So we started with Africa and South America, and we've completed the first wave countries there. We haven't moved significantly to Asia yet, but that's in the process. And then the other thing that would be helpful, because I think you were asking about theranostics specifically, is we have specific projects that can be tailored to a specific goal. So, for example, it could be a nuclear medicine specifically for theranostics training. That's also through the NLO. That's our main contact with the country, and it could be either national just for the country, or if it's training and education, sometimes it could be regional projects as well. So those are the main things. And the last thing I wanted to say is, right now we already have theranostics webinars. If you're interested in participating, we can share that information with you until all the other steps are completed. Thank you very much.
Thank you, May. There are quite a few more questions online, so I will try to put them on as fast as possible. One question was about this session. Would it be recorded? I guess so, Hedy?
Yes, the session has been recorded and it will be available on our website for strengthening medical imaging, as well as on the website for the ISR, and I believe for the World Federation of Nuclear Medicine and Biology as well. So yes, it is recorded and will be available.
Thank you. One other question would be about access and travel distance. Sometimes it's limiting the care and the critical road to define access. And someone is asking about the role of geospatial information system. How do you apply in defining access to medical imaging these technology and techniques? I don't know who would like to answer these questions. It's more about networking and how to communicate between centers.
Maybe Will can answer that because he's very involved with building the digital. Oh, Adriana, excuse me.
No, don't worry. Do you want me to answer, John?
Yes, please.
Okay, thank you very much. Something that is really important is whoever is making the decision strategic at the country level. Normally we use a transportation time or access time of 2 hours, but it will be really important. And just following on the previous questions and also as Viv was stating, we need to make sure that you have imaging technologies in the primary healthcare and then the secondary and then the tertiary, and that the reference to each of them is coordinated. You don't want to put high technology everywhere, not even at 2 hours access, but you need to distribute well the technology to be able to diagnose quickly in the primary healthcare, and then if complications that you have ways to resend to a higher level. Over. I hope I covered, and maybe somebody else wants to complement. Thank you.
Thank you very much, Adriana. One question would be also about the role of patient advocate groups. So this could be a question to Will. It's someone from Uganda who is asking the question. Will, could you answer about the patient advocate groups' role on?
Yeah, absolutely. That's a really important question because, I would actually say, patient advocate groups are really critical for creating the kind of mobilization and action that we are seeing here today. I would say, for example, with the Lancet Oncology Commission for Sub-Saharan Africa, a lot of patient advocates are part of that solution. They are sitting on the table. Some of them were actually part of the commission and part of the action. And I know that the importance of that is really that you want to make sure that those voices are being heard, and it's also you can hear from the local perspectives, because some of these depend on what culture, what geography. It's really important for you to have these patient advocates that can really drive the action around this that will be relevant to them, to their local context. So that's a really important question. I would say that, in the US, for example, we've had American Cancer Society, a lot of the patient advocates groups that are really involved in driving cancer. You can know it's really huge. And in Africa, I'll give you one example. In Ghana, Breast Care International, they have like a march that happens every October, like about 70,000 people who march on the streets, including patient advocates that are really driving action and mobilization and already having an impact. And so, if you're part of a patient advocacy group, yeah, I'm sure that, Hedy and the leadership will be willing to welcome you to be part of this driving action around this resolution.
Thank you very much, Will, for your answer. It's about time to conclude, so I don't know if we really need to finish now or if we can get one last quick question. Hedy, I would let you decide.
One more question.
Okay, then I would take the question of Yves Frija. Is asking because of 80% of the needs are usually in rural and semi-rural areas where very simple equipment like portable X-ray or US would be useful. Do you think this could solve a lot of click and lead without expensive equipment? And this is something that should not be overlooked. Maybe someone could answer this question. I don't know if we have any data. Will is willing to answer this, I guess.
Adriana has her hands up.
Sorry, I didn't see Adriana.
No, very quickly, just absolutely agree with you. And the list that we used to have for primary healthcare, we're talking about maybe ophthalmoscope, otoscope, and a pressure monitor. Right now, it is including imaging. So point of care ultrasound, yes, ultra portable X-ray machines, which, by the way, we did the specifications along with the IAEA. So absolutely, yes, technologies, the access to technology should be better and should be everywhere. Thank you.
Thank you,
Yeah,
Adriana.
and I'll just add, if you don't mind, John, you know, I know Beeb mentioned AI. So I will tell you what's happening in Africa right now. So what's happening is people are using even their mobile phones, you know, to take images. But, you know, you need to kind of liaise that to, you know, AI, but also the workforce. That's where the workforce becomes really, really important for you to have that. But the penetration of digital technology now across Africa and lower mid-income countries really provides us a great platform where you can have point of care, you know, technologies, including the ultrasound that Adriana mentioned, but you can even think about, you know, point of care technologies that you can, you know, connect that to the cloud, you know, connect that with digital technologies that can now help us increase access to care, you know, bringing that to communities, you know, where prior to that, they could not get there. It really helps us to leapfrog. So that's an area where, you know, I think there's going to be a huge impact.
So thank you very much. I will conclude by reading a few statements for saying thank you for this session. It was good. Someone hoped that the resolution will go through. And one last quick question I can answer in a second. Is the biomedical and clinical engineer implied? Yes, the non-state actor about biomedical engineering is within this resolution. So with this being said, I would give you back the word for the final conclusion.
Thank you, John. And just a shout out to biomedical imaging. We really believe that biomedical imaging, biomedical engineering is our future and definitely belongs to this resolution. To all the speakers and to all the participants, from the bottom of my heart, thank you so very much for supporting us. And let's hope we'll all have a drink of non-alcoholic champagne in May after the resolution passes. Thank you very, very much, all of you. Thank you.